Hi, my name is Alice Nalobamba, and I'm pursuing a master's degree in nursing as a family nurse practitioner at Gonzaga University. I have been a registered nurse for the past 7 years now, and my interest in nursing started at the time when I was 12 years old. My mother gave me a book on Florence Nightingale, and from then on, it's been my passion, and I've continued to pursue nursing. My first job was at an assisted living right before I went into the nursing program. And I really loved what I did there. I loved my job, and I knew that this was what I really wanted to do. Um, After graduating nursing, I worked at a nursing home and then transitioned to a rehab facility where we worked with joint patients. That's patients that had knee, hip, shoulder fracture surgeries until they were able to take care of themselves and then discharged to home. Currently, I work as a registered nurse at a local hospital in Tacoma. I work on the neuro-ortho floor, and I've also had an opportunity to float to other med-surg floors. And I've worked with where I work with various diverse populations. My philosophy on nursing starts with a personal responsibility to provide a safe and compassionate care that is non judgmental but caters to the needs of various populations. Being accepting of the ethnic group way of life and empowering them into making healthy lifestyle choices. Over the years, I have come to realize that there's more to nursing than just providing compassionate care. I've become an educator. I provide information to my patients on how to take care of themselves, how to give themselves subcute injections. I provide information for newly diagnosed diabetic patients and just so much more. Nursing involves being an active listener. You really have to listen to what your patients are telling you, otherwise, you miss some very important information. Um, that will help you in coming up with an individualized plan of care. I've also come to value a holistic approach to care that takes into account one's environment, their physical, um, emotional, as well as mental well being, as being imperative to healing. However, there are times whereby um, your plan of care might not align with the patient's needs and stuff like that. So you have to look at what is going to be the most beneficial um, outcome for them. I'll give you an example. At one time, I worked with an 85-year-old female that came in for a fractured hip. The family really wanted her to have surgery, but she was kind of reluctant. She didn't want to go through with it. So I decided to find time to talk to her and find out what was really going on because she was getting very withdrawn, was refusing care. And then I found out that she lost her husband, whom she had been married to for 50 years, like a couple of months ago. And she knew that this was going to limit her mobility, but she just wasn't interested in surgery. I realized then that it was more important for her to have somebody to talk to about this or have a mental evaluation before we can continue with the surgery. Therefore, I have realized that for healing to take place, it is very important to understand our patient's inner and outer struggles, as this could potentially slow the healing process. Being empathetic to their needs, being an active listener can change how we respond. I consider pursuing my degree as a nurse practitioner as a way for me to not only promote healing from a physical point, but also taking into account the environment, the emotional and mental well-being to promote a healing environment for the patient. Thank you for listening.